Intervention-generated inequalities. These are inequalities that occur when interventions actually widen the gap between the most and least socially disadvantaged populations, thus resulting in unfair and unjust outcomes. And these are closely related to the inverse care law and the inverse prevention law. The first inverse care law was proposed by Julian Tudor Hart in 1971, that medical care is inversely related to the need for it. And this is still true today in some areas. For example, areas of high need, such as inner city, may actually have fewer clinics, and those clinics may be overcrowded and unable to provide as high quality services. Secondly, the inverse prevention law states that populations most likely to benefit, so those with the highest risk, may be the least likely to receive preventive measures. And one example of this is cancer screening, which is known to have very low uptake in those who are living in socially deprived circumstances. Why do these unjust and unfair intervention-generated inequalities occur? They may occur because of issues related to access, understanding, engagement, even related to issues such as fear and mistrust, or qualities of the interventions themselves. Some interventions may increase inequality, such as information provided through print materials, mass media, and some may reduce inequality. Structural or fiscal interventions, such as tobacco pricing, may reduce inequalities. And this is why reviews need to assess these inequalities. In public health interventions that are rolled out to a whole population, they may initially benefit only those with higher socioeconomic status, and thus they may inadvertently increase inequities. This may be reduced over time as more disadvantaged groups gain awareness, but it may not. So interventions really need to be designed with an equity lens to assess and ensure that benefits reach the most hard to reach segments of the population. And last, Cochrane reviews can help by consistently reporting differential effects if they occur, in order to build the evidence base on inequities.